We are seeing in the state an unprecedented spike in hospital utilization, and it is impacting all areas of the state. Our previous waves during the spring and summer months were much smaller, and we were able to avoid overwhelming our hospitals by pulling together to reduce spread. The capacity challenges facing our hospitals during the spring and summer were different, though, than they are today. We were primarily concerned with the availability of limited global supplies of personal protective equipment, coupled with high demand for critical care and ventilator beds. To address those concerns, the state established the structure that the governor reviewed with us, and it really has allowed some of our larger health systems to help coordinate and work with our rural and community hospitals to balance surges that we have been seeing over the course of the pandemic. Today, we are better prepared with the personal protective equipment resources and physical capacity. However, what we are seeing now as cases surge is an increasing demand on our staffing. Every county in the state is feeling the brunt of rising COVID-19 hospitalizations, and those hospitals are staffed by nurses, physicians, and other healthcare professionals who live in those communities. As COVID-19 transmission rates rise in our communities, that depletes our staff as more and more of them are pulled from the bedside by community exposure. I'll turn to our panelists in a moment, but I want to emphasize that if we don't see a shift in the way things are going, meaning if we don't control the spread of the virus and our case numbers, we won't be able to continue caring for the acutely ill without postponing important but less urgent care. And we anticipate that this kind of shift could happen quickly in a matter of weeks if trends don't change.